Then filming techniques. So we have learned about the procedure. Now in intravenous pyelogram, you will see the filming techniques used in intravenous pyelogram. So if you see the filming techniques, first and foremost, we use low kilovolts exposure should be taken, that is 65 to 75 kilovolts should be exposed. Similarly, high milliamperes of around 600 to 600 to 1000 milliamperes of current is exposed, and this is exposed only for short period of time, that is short exposure is preferred. Now the standard films are taken. The standard films are taken, which include, we can take a plain X-ray KUB is taken, or we can also call it as couch film is taken of around 14 inches into 17 inches. Okay, then we will take an 1 minute film followed by 5 minutes film. Then we take 10 minutes, 15 minutes, and 35 minutes film. And finally, we will take a post void, that is after going to urine. We take one more film, which is post void film, is taken in the intravenous urogram. So first film is called as scout film. Scout film is actually the plain X-ray KUB, which is taken in order, this is a control film in order to know, to see the changes prior, that is before injection of the contrast. We can use this scout film. This scout film will assess whether there is any calculus or not. It will also help us in assessing the whether bowel gas shadows are present, because if gases are present, we do not do intravenous pyelogram. Similarly, we should see whether the calcifications are seen, or if there is any abdominal mass is present, or in case of foreign body, we can use this plain X-ray KUB. Then the next, after plain X-ray KUB or scout film, we can also do 1 minute nephrogram is taken. This 1 minute nephrogram will produce the, actually this is most commonly omitted, this is not done always, because the renal outlines are better visible at 5 minutes, are better visible at 5 minutes, so as a result this is mostly omitted. Then after 1 minute, we will take a 5 minute film is taken. Okay, in this 5 minute film, this 5 minute film will show the nephrogram. It will show nephrogram, it will show renal pelvis, and it will also show upper part of ureter. So this 5 minutes, if you see, so in this 5 minutes, this will show the complete kidney border clearly. So it will show nephrogram, it will go into renal pelvis, and also it goes into the upper ureter also. Then in this, at this stage of 5 minute film, at this 5 minute film, we can apply a compression band, can be applied around the abdomen of the patient. If this is the abdomen of the patient, around the abdomen we can apply a compression band around the abdomen of the patient in this 5 minute film. Okay, this compression band is positioned at anterior superior iliac spine, where ureters cross the brim. Because when you put a compression plate at this position, this will result in better pelvic calyceal system distension, and thus we can better visualize the pelvic calyceal system on using this compression band. But But this compression band is not used in all patients because it has some contraindications. This compression band is actually contraindicated if the patient has renal trauma, because this can increase the trauma, or if the patient has any abdominal mass. If the patient has any large abdominal mass, then this compression band will also compress the abdominal mass, or if the patient has any abdominal aneurysms, or if after any abdominal surgeries, or it is contraindicated after abdominal surgery. In all these cases, this compression band is contraindicated. Then if you see in 5 minutes film, if after taking 5 minutes film, if you see that the calyces are dilated, whether the calyces are dilated, that is dilated calyces like this, if they are fully dilated, or if the calyces not opacified adequately, if the calyces are either dilated or if they are not opacified, in both these conditions it suggests that there is an obstruction is present at the levels of the calyces, and as a result we should not use compression bands are not applied in these conditions, because obviously there is an obstruction present, so it is not good to use the compression bands. Then if we apply compression band, then a compression band is applied. After applying compression band, after 5 minutes of compression, a film is taken. That is, it is taken at 10 minutes after contrast injection. That is after compression band is put 5 minutes after contrast, that is at 5 minutes level. So after putting compression band, you will wait for 5 minutes for the compression to act, and then you will take a 10 minutes film. And in this 10 minutes film, you can see the collecting system which is distended, and also proximal ureter which is distended can be seen clearly. Then followed by this, we have a 15 minutes film. The third one is we have 15 minutes film. In the 15 minutes film, this 15 minutes film will help, is often better in prone position than supine, because the filling is better in prone position when compared to supine, and in prone position it will actually reverse the curve of inferior course of ureter. It will reverse the curve of inferior course of ureters, and as a result, this 15 minutes film is better in prone position than in supine position. When there is actually in supine position, the patient's curvature will be like this, whereas in prone position it's exactly reverse, and as a result, this will make the kidneys anti-dependent of gravity. So the kidneys are not dependent on gravity when you take the picture in prone position, and as a result, this will reverse. This will have a better method at 15 minutes film. Then after 15 minutes, in the 15 minutes film, there is one more method which can be used. That is, we also in the 15 minutes film we can also use modified Trendelenburg technique can also be used. In modified Trendelenburg technique, this modified Trendelenburg technique, we use 15 to 20 degrees head low tilt is taken with patient in supine position. Patient is in supine position, we can take 15 to 20 degrees head low tilt in 15 minutes film. Followed by this, we have the next film, that is 35 minutes film. Okay, in 35 minutes film, we can see the complete overview of kidney, ureters and bladder. Complete overview. Complete overview of ureters, actually of urinary tract. that is from the kidney to the ureters and the bladder can be assessed. At 35 minutes film especially we can assess the bladder distension can be assessed at this 35 minutes film. Then followed by 35 minutes film we will take the last film which is post void film. In post void film it is taken immediately and it will assess this will assess or this also assess the liver pressure or if the patient has any diverticular will help divert or bladder tube outlet obstruction also assess the outlet and vesico-urinary reflex. So these are the different films which are used in intravenous. That is, have seen standard films that is in 1 minute come, 5 minutes come. Then we have a 15-minute film followed by 35 minutes. Thank you.